Ladies and gentlemen, it's a great pleasure to be here and to give you a brief insight in how cancer prevention works, and I'd love to share some visions on how we can improve that. So I'm heading the Department of Clinical Trials at the University Hospital Hamburg-Eppendorf, as well as the Department of Cancer Prevention, and yeah, I'm happy to be here. So it's no surprise that in the evenings my family loves to discuss morbidity and mortality. And my son came up to me just a few weeks ago and he asked me, "Daddy, what will be the cause of my death?" And I told him, there's bad news and there's good news. The bad news is death is inevitable. But good news is we don't know why, when, and how. It took 24 hours and he came up with this picture. And he told me, "Daddy, I think I'm gonna be eaten by a shark." And he also told me the subspecies of this shark. I'm sorry, I forgot. I think he knows all the different subspecies of sharks, and he explained to me that that will happen to him. I didn't tell him, but I think that is quite unrealistic. Chances of a fatal shark attack range around 1 to 280 million. Not very likely. Plane crash, what an alternative. It's 100 times more likely, but still unlikely. Struck by lightning, that's my biggest fear. 1 out of 350,000. Fatal car accident, 1 out of 7,000. And you realize it becomes much more realistic now. Food poisoning, 1 out of 7. Cardiovascular diseases, not a big surprise, 1 out of 4. Obesity-related diseases, 1 out of 4. And cancer, 1 out of 3. So, what is cancer? Cancer is the development from a normal cell to a malignant cell that divides and doesn't respect the neighborhood anymore. But that is a process that takes years to decades, giving us plenty of opportunity to interfere, to detect early forms, adenomas that have to transfer into carcinoma. So what can we do? Cancer treatment. Even though there are some great developments towards cancer treatment in some entities, it still remains a challenge to most of those who have to fight cancer, especially in a metastasized situation. Secondary prevention. There are many options. I'm going to give you a brief overview of what we can do in terms of secondary prevention. Early detection and detection of pre-malignant lesions. And what can we do? Primary prevention. We have many options to prevent cancer development in the first place. So just to give you an insight on one of the most common cancer types, lung cancer. You see it down here, 6%. 6% means once the diagnosis of lung cancer is placed, chances to survive another 5 years is 6%. And lung cancer is one of the most common types of cancer. Colon cancer, a little bit better. Once you have a diagnosis of colon cancer, chances you survive the next 5 years is 45 to 48%. So we're talking about serious business here. What we do in cancer treatment, we're swiping the floor as good as we can, but we don't do the most natural thing. We don't close the faucet. Screening recommendations, they're out there. And best of all, your healthcare provider pays for that. What do we recommend? Annual breast exam for women 30 years up, yearly biannual skin check, malignant melanoma, 35 years and up, annual prostate exam 45 years and up, biannual mammography starting 50 and up, and colonoscopy every 10 years after the age of 55. Let's stick with the colonoscopy. This shows you the cumulative participation in screening colonoscopy over the past 10 years. Only 16.3% in Germany underwent this screening colonoscopy. And believe me, most of them survived the procedures. 83% didn't. Why is that? And hard to believe, almost 50% said, I don't have time for that. I don't have time for a screening colonoscopy. Sure, it takes 30 minutes and you have to be prepared. Another good reason, I'm not willing to pay for future therapy because they can find something and then they charge me. The idea is the other way around. We find something, a small adenoma, we remove it, get rid of it, and it doesn't cost anyone a penny. Fear of pain, we let all these patients sleep because we want them leaving the hospital telling everyone that was great. I didn't feel anything. Fear of bowel preparation, I can understand that. If you try this saline, it's not my favorite drink and it will never be. Colonoscopy of no significance. Yes, almost 5% of all people say, what the heck, that doesn't work. And 4% say, I'm not interested. But we are. And we are not only interested in the patients, but in their families. Because there are details hidden that give us an indication for a special risk for cancer, a genetic defect. And this genetic defect is always a good clue if you have many members in your family with cancer, especially at a young age. And it's really worth looking for these genetic defects. And why is that? Because underlying genetic defects play a different game. You have different screening recommendations in families that have this genetic burden. So genetic predisposition determines individual screening recommendations that can be completely different from what we recommend the normal people. So, but we should be aware, genetic defects are only responsible for 15% of all cancers. So what else causes cancer? Human behavior, unfortunately. And the biggest player in this field is smoking. Smoking causes 30% of all cancers. That's a number. Nutrition deficits, another 30%. Overweight, 5%. Alcohol, 3%. Infections, 5%. Drugs, UV, and job-related, 5%. The job makes me sick. Gets a different meaning now. So, what can we do about it? We can change it. And changing these behavioral risk factors, that is primary prevention. And that starts early on. What is a healthy lifestyle? All of you have something in mind. Healthy lifestyle. Low carb, low fat. Maybe no fat. No calories, that doesn't work. Some calories should be. No food past 5, no food at all, doesn't work. Supplements, detox, it's not that complicated. You can boil lifestyle down to 5 factors. And I'm going to show you these 5 essential components of a healthy lifestyle. And it's really, really easy. Number 1, be active. You don't need to go skydiving. Yeah, it helps if everything works well. But at least you don't die of cancer. No, 60 minutes of physical activity every day. You can split that in 4 portions the way you want, but be physically active. 60 minutes every day. What an impact. That was too fast. Eat healthy. That's also not very complicated. What we recommend is simple. It's a plant-based diet, number one. Meat, not more than twice a week. Fish, at least twice a week. Your calorie intake should fit to your physical activity. More physical activity, more calories, very simple. And one dairy portion a day. Milk, yogurt, cheese, whatever you prefer. The next one is an easy one. Limit alcohol consumption. And that's easy because one drink a day, or no drink. But not more than that. Quit smoking. Don't start smoking. And second-hand smoke also kills horses. Poor cowboy. Think positive. Downshift. Take time with your loved ones. Take yourself more serious. Put yourself into the center. So, after that being said, that sounds easy. Why don't we do that? Why don't we live like that, if it's so easy? And the answer is probably this one. We are living in a complex society, in a very tight network, with people telling us all the time what to do, what not to do, what to eat, what to drink, how to live, how to love, how to die. They tell us all the time what to do and what not to do. So, how to make up your mind? It doesn't come out of the blue that we spend money we don't have for things we don't need to impress people we don't like. So, and it's funny that we have the same picture up here. There's nothing wrong with these companies except the one that sells drugs. These companies, they pursue different interests, and these interests are not yours. The beer brewing company, they want to sell as much beer as possible. But that doesn't mean that you have to drink as much beer as possible. Your interest is quite different from those you're exposed to every day. And that needs to start early. A healthy lifestyle needs to be implemented early on, in kindergarten and earlier. You don't expect them having a normal life expectation anymore. So, change ahead, changes now. I tell you why I believe that we need to change now. Our healthcare system, we got some exciting data on that, costs us billions of euro every year. That is one part of the story. We have less taxpayers every year. Our population gets older and older, and we have more people who need medical attention. And we have more people who cost expenses and less people who provide the financial support for that. So how can we prevent this system collapsing? By reducing the number of diseases. And lifestyle adjustment early on provides you freedom and avoids out of self-control. Because having a cancer doesn't really mean that you're in control of things. You have to go to the doctor, you get your chemotherapy, people do some operations, radiotherapy. At the end, with an advanced cancer, you're completely out of control, out of self-control. And early on, you have the freedom to be in control. That's why we need to start there. And best of all, chances are that we can not only reduce cancer by 80%, but many other diseases as well. Cardiovascular diseases. Risk factors are pretty much the same. So it's not that you avoid cancer, you can also avoid cardiovascular diseases in probably the same amount, 75 to 80%. What we need to realize, if we want to change the behavior, we need to stimulate the limbic system. Lifestyle needs to be fun. People need to enjoy living. Fear of dying will not work in preventing cancer. So we should not forget the limbic system if we want to implement a lifestyle change that is sustainable. Change your lifestyle, preserve yourself. There's nothing wrong in preserving the rainforest, penguins, dolphins, but preserve yourself. Thanks.